In this video, we will explain why ginger can be potentially harmful for some people despite its reputation as a powerful natural remedy. For thousands of years, ginger has been used in both medicine and cooking for its anti-inflammatory and invigorating properties. However, in certain situations, it can cause harm. Its sharp taste and spicy aroma may hide a potential threat for people with specific health conditions. We will take a closer look at the circumstances under which consuming ginger is not recommended, and why ignoring these facts can seriously affect your health, and in some cases, even lead to the end of life. This video is going to be incredibly informative and helpful. If you want to take control of your health like a pro, give it a like, and let's get started. Number 1. Circulatory issues, when a beneficial property becomes a potential danger. Have you ever wondered why ginger is often recommended to improve blood circulation? It all comes down to gingerol, the active compound that makes ginger so unique. Gingerol has a powerful natural blood thinning effect similar to that of pharmaceutical anticoagulants. Now imagine this situation. You regularly take blood thinning medications prescribed by your doctor, and at the same time, you decide to add ginger tea to your diet without knowing about its effects. What happens inside your body? According to a 2023 study by the American Society of Hematology, ginger can inhibit platelet aggregation by an additional 27% in patients already prone to clotting disorders. This means your blood can become so thin that even a minor injury may result in significant bleeding. An even more concerning finding came from a study published in the Journal of the American College of Cardiology in 2024. It turns out that consuming more than 4 grams of ginger per day, which is approximately 2 teaspoons of freshly grated ginger, increases the risk of hemorrhagic complications by as much as 18% in people taking anticoagulants. Imagine being in a high-risk group without knowing about this interaction. The consequences can be devastating. Marina, 58 years old, a patient with thrombophilia, shares her story. After my stroke, I was prescribed warfarin. No one warned me that my favorite ginger tea could be a problem. After 2 weeks of drinking it regularly, I started experiencing nosebleeds that were very hard to stop. Only then did my doctor explain the connection between ginger and my medication. That is why, if you have any kind of blood clotting disorder, if you are taking anticoagulants, or if you're preparing for surgery, it is best to avoid ginger. Your well-being may quite literally depend on this decision. Number 2. Diabetes, ginger and sudden blood sugar fluctuations. Living with diabetes means constantly trying to maintain a balance in blood sugar levels. Many people with diabetes are aware that certain foods can cause rapid changes in glucose levels, but few realize that ginger is one of them. In a 2023 study conducted by the American Diabetes Association, researchers discovered an interesting yet concerning fact. Consuming just 1.5 grams of ginger daily, a little more than half a teaspoon, can lower levels of glycated hemoglobin HbA1c by 0.7% over a period of 90 days. Sounds beneficial, right? But here's the troubling part. In 22% of participants in the same study, researchers observed a sudden and unpredictable drop in blood sugar levels, so sharp that it caused dizziness, weakness, excessive sweating, and in some cases even led to fainting. Alexei, 64 years old, who has been living with diabetes for 15 years, shared his experience. I started adding ginger to my morning tea after reading about its benefits for people with diabetes. After just a week of this routine, I began to feel really unwell during an important business meeting. My hands were shaking, I was sweating heavily, and I almost passed out. When I checked my blood sugar, the numbers were critically low. My endocrinologist was shocked when he found out I was drinking ginger tea while taking metformin. Additionally, a recent study by the National Institute of Diabetes revealed another risk. The interaction between ginger's blood-thinning properties and diabetic conditions presents unique challenges for 35% of patients with type 2 diabetes. This is because individuals with diabetes often already have issues with microcirculation, and further thinning of the blood may worsen the condition of small blood vessels, especially in the eyes and kidneys. If you are living with diabetes and still wish to include ginger in your diet, remember, this should only be done under strict medical supervision with regular monitoring of your blood sugar levels and in very limited quantities. Your endocrinologist needs to be aware of every attempt to introduce ginger into your routine. Number 3. Gallbladder issues when ginger makes the pain worse. The human body is a complex system, and the gallbladder plays a key role in digestion. For many people, problems with this organ can become a real nightmare, and ginger can make the situation even worse. According to the National Institute of Diabetes and Digestive and Kidney Diseases, around 25 million adult Americans suffer from gallbladder problems. Women are twice as likely as men to be affected. So why does ginger become a real enemy for people dealing with these conditions? Imagine a gallbladder that already contains stones. It is like a ticking time bomb that can trigger sharp pain at any moment. Ginger acts as a catalyst. It stimulates the production of bile and increases the contractions of the gallbladder. When the gallbladder contracts, the stones can shift, block a bile duct, and that is when the pain begins. Often described by patients as unbearable pain in the upper right abdomen radiating to the back and shoulder. Olga, 42 years old, recalls, "I knew I had gallstones, but they were not bothering me, so I postponed the surgery. When I caught a cold, I decided to treat myself with ginger tea and honey. 2 days later, I ended up in the hospital with a severe attack. The pain was so intense I could not even breathe. The doctor told me that ginger triggered a flare-up of my gallstone condition." In cases involving gallstones, even a small amount of ginger can cause a serious aggravation. It is especially dangerous for those who have stones but do not yet know about them. If you have ever experienced pain in the upper right part of your abdomen after eating fatty foods, nausea, a bitter taste in your mouth, or a yellowish tint in the whites of your eyes or your skin, you should definitely consult a doctor before adding ginger to your diet. Even for people with simple bile stasis or gallbladder motility disorders, ginger can increase spasms and cause discomfort. That is why, in the case of any gallbladder issues, it is better to choose gentler alternatives to support digestion, such as herbs like peppermint or fennel. Number 4. Heart conditions, added strain on an unstable heart. The heart is the engine of our body, and any interference with its function can lead to serious consequences. Ginger, with its active compounds, can have a significant effect on the cardiovascular system, and that effect is not always positive. A 2024 study by the American Heart Association revealed an interesting paradox. Moderate ginger consumption reduces the risk of cardiovascular disease by 8% in healthy adults. However, for people who already have heart problems, the situation is completely different. For patients with arrhythmia, for example, consuming more than 2 grams of ginger per day increased the frequency of tachycardia episodes by 15%. Nikolay, 67 years old, who has been diagnosed with atrial fibrillation, shares his story. "During the winter, I started drinking ginger tea with lemon, thinking it would help me avoid catching a cold. After a week, I noticed my heartbeat became even more irregular, and I had the feeling that my heart was pounding out of my chest. My cardiologist had to adjust my antiarrhythmic treatment and strictly forbade me from consuming ginger in any form." The combination of ginger and heart medications is especially dangerous. According to data from the American College of Cardiology, in patients who take warfarin, a common medication used to prevent strokes in those with arrhythmia, and also consume ginger regularly, the risk of internal bleeding increases by 26%. Imagine if such bleeding occurs in the brain. It could lead to a hemorrhagic stroke with devastating consequences. Even for people with hypertension, ginger can pose a problem, as it may enhance the effects of blood pressure medications, leading to an excessive drop in blood pressure. This can cause dizziness, weakness, and in severe cases, fainting, especially when standing up quickly. If you have any cardiovascular conditions, particularly arrhythmia, high blood pressure, or if you are taking anticoagulants, you must consult your cardiologist before consuming ginger. You may need to eliminate it from your diet entirely or strictly limit the dosage. Number 5. Interaction with medications, a dangerous mix inside your body. Many of us do not realize that natural products can interact with medications just as strongly as pharmaceutical drugs. Ginger is one of the most active players in this area, capable of significantly altering the effectiveness of many common medications. The National Center for Complementary and Integrative Health warns that ginger can intensify the effects of several types of medications. For example, it can greatly enhance the impact of drugs that lower blood sugar levels. Imagine you're taking metformin and then drink a strong cup of ginger tea. Your blood sugar could drop to dangerously low levels, leading to hypoglycemia with symptoms such as trembling, sweating, confusion, and even loss of consciousness. Anna, 52 years old, shares her experience. I was taking losartan for high blood pressure and decided to cleanse my blood vessels with ginger. That same day, my blood pressure dropped to 85/50, and I felt so weak that I could not get out of bed. My husband had to call an ambulance. The doctor explained that ginger had intensified the effect of my blood pressure medication several times over. Interaction with anticoagulants is especially dangerous. According to data from Mayo Clinic proceedings, taking ginger together with warfarin, a common medication used to prevent blood clots, increases the risk of internal bleeding to the point of potentially life-threatening conditions. Bleeding may not be noticeable at first. For example, microbleeding in the gastrointestinal tract may show up only as general weakness and anemia. But over time, this can lead to serious complications. Ginger interacts actively with a range of medications, and this is especially important to consider when taking them regularly. The most significant interactions are observed with four main groups: with anticoagulants such as warfarin, rivaroxaban, and dabigatran, with blood pressure medications including losartan, amlodipine, and enalapril, with antidiabetic medications such as metformin, insulin, and glibenclamide, with non-steroidal anti-inflammatory drugs including aspirin and ibuprofen. These interactions can be serious, so consuming ginger requires caution. It is also important to understand that interaction may occur not only when ginger and the medication are taken at the same time, but even if there are several hours between them. The active compounds in ginger can remain in the bloodstream for up to 24 hours, especially if you consume it regularly. If you take any medications on a regular basis, you must consult with your doctor before adding ginger to your diet. In some cases, your doctor may need to adjust your medication dosage or recommend that you avoid ginger entirely. Always inform your healthcare provider about any herbal supplements and spices you consume regularly. Number 6. Low body weight, when ginger gets in the way of gaining necessary mass. We often hear about ginger as a tool for weight loss, and it is true, its thermogenic properties can be helpful for those trying to shed extra pounds. But there is another side to this story. For people who are underweight or trying to gain weight, ginger can become a real obstacle. Research from the Harvard T.H. Chan School of Public Health shows that regular consumption of ginger can significantly speed up metabolism and reduce appetite. This happens due to the activation of thermogenesis, the process by which the body burns calories to produce heat. For people with excess weight, this can be a benefit. But for those who are dealing with low body weight, this effect can be highly undesirable. Daria, 29 years old, shares her experience. After a long illness, I had lost a lot of weight and was trying to gain it back, but I was also dealing with frequent colds and started drinking ginger tea every day. Despite a high-calorie diet, I could not gain weight. Only after my nutritionist advised me to cut out ginger did things improve. Within a month, without ginger, I gained 3 kilograms, which I had been trying to gain for 6 months. According to a publication in the Journal of the Academy of Nutrition and Dietetics, taking ginger before a meal can reduce appetite and lower total calorie intake by 15 to 20% per meal. For people who are trying to gain weight after illness, for athletes looking to build muscle mass, or for older adults struggling with age-related weight loss, this can pose a serious challenge. People with certain health conditions need to be especially cautious when consuming ginger. These include those recovering from severe illnesses, individuals suffering from anorexia or other eating disorders, and people with hyperthyroidism where the metabolism is already elevated. Others at risk include individuals with malabsorption, a condition where nutrients are poorly absorbed, and older adults dealing with age-related sarcopenia, which involves the loss of muscle mass. If you are trying to gain weight for medical reasons, it is best to eliminate ginger from your diet completely or reduce its intake to the minimum. It is also important to remember that ginger is present in many ready-made foods and drinks, so always read ingredient labels carefully. Number 7. Pregnancy. Caution during a critical period. Pregnancy is a special time when every woman becomes especially mindful of what she eats and drinks. Ginger is traditionally recommended for relieving nausea, but modern research shows that its use during pregnancy requires great caution. A comprehensive 2023 study by the American College of Obstetricians and Gynecologists, which included 2,500 pregnant women, revealed a concerning trend. Consuming more than 1 gram of ginger per day during the first trimester was associated with a 12% increase in the risk of complications, including subchorionic hematomas and threats to pregnancy continuity. This is linked to the anticoagulant properties of ginger, which may affect placental development in the early stages of pregnancy. Ekaterina, a mother of 2, shares her story. When I was pregnant with my first child, I suffered from severe nausea. I drank ginger tea by the liter, thinking it was healthy. At 11 weeks, I began experiencing light bleeding, and the doctor found a subchorionic hematoma. I was immediately admitted to the hospital for monitoring. Only then did I learn about the possible connection with ginger. Even greater risks are associated with consuming ginger during the 3rd trimester. A 2024 study conducted by the American Society for Reproductive Medicine found that women who consumed large amounts of ginger, more than 2 grams per day, in the final weeks of pregnancy had a 23% higher volume of blood loss during childbirth. This can lead to postpartum complications, including anemia, and in severe cases, the need for a blood transfusion. The reason is that ginger's blood-thinning effects interfere with the clotting process during labor, which is critically important for stopping bleeding after the placenta separates. Disruption of this process can result in serious consequences for both the mother and the baby. It is important to understand that ginger consumption during pregnancy is not absolutely prohibited. It is a matter of dosage and the body's individual response. In small amounts, no more than 0.5 grams per day, which is roughly equal to 1/4 of a teaspoon of freshly grated ginger. It may be helpful for managing nausea in the first trimester. However, pregnant women should follow several recommendations. First and foremost, any use of ginger should be discussed with an obstetrician gynecologist. If there is a history of pregnancy loss or existing blood clotting disorders, ginger should be avoided entirely. It is especially important to be cautious during the 1st and 3rd trimesters. These are the periods when the impact of any active substances must be carefully controlled. It is also recommended to avoid concentrated forms of ginger, such as tablets, capsules, or extracts. Remember, the goal of relieving nausea symptoms should never come at the cost of creating new risks for your baby. Number 8, low blood pressure, when dizziness becomes the norm. If you believe in traditional remedies, ginger seems to help with just about everything, including blood pressure issues. But what exactly happens to blood pressure when you consume ginger? And why can this be dangerous for some people? Ginger contains bioactive compounds like gingerol and zingiberine, which act as natural vasodilators, substances that widen blood vessels. When the blood vessels expand, the pressure inside them decreases. For people with high blood pressure, this can be a helpful effect. But for those whose blood pressure is already below normal, it can become a serious problem. According to the American Heart Association, approximately 38% of Americans over the age of 50 experience episodes of hypotension or unstable blood pressure. In such cases, even a small additional drop in blood pressure, which can be triggered by consuming ginger, becomes critical. This often results in pronounced symptoms such as intense dizziness, especially when changing positions suddenly, blurred vision and seeing floaters, general weakness, and quick fatigue. It can also lead to fainting, near fainting spells, increased sweating, and nausea. All of this means that people with unstable blood pressure must be extremely cautious when it comes to consuming ginger. Galina, 64 years old, shares her story. I have always had low blood pressure, 90/60, and I had learned to live with it. But when I started drinking ginger tea to prevent colds, things got worse. I fainted twice right in the store and had to be hospitalized. At the hospital, my blood pressure was 75/40, dangerously low. Things only stabilized after I stopped consuming ginger. It is especially dangerous to combine ginger with medications that also lower blood pressure, such as diuretics, beta blockers, antidepressants, nitrates, and others. In such cases, a synergistic effect may occur where the combination of substances works more strongly than the sum of their individual effects. It is important to understand that low blood pressure, hypotension, can be just as dangerous as high blood pressure, hypertension. A sudden drop in blood pressure can lead to insufficient blood flow to the brain and other vital organs. This is especially risky for older adults, where a fall can result in fractures and other serious injuries. If your blood pressure is usually low, below 100/60, if you take medications that reduce blood pressure, or if you often feel dizzy when standing up, it is best to limit or completely avoid ginger. In any case, regularly monitoring your blood pressure will help you stay in control and respond to changes in a timely manner. Number 9. Preparing for surgery, when ginger can lead to complications. Many of us do not pay much attention to what we eat before a scheduled surgery, usually just following the doctor's instructions to fast for 8 to 12 hours before the procedure. However, the effects of certain foods, including ginger, can remain in the body much longer and create serious risks during surgical intervention. A 2024 study by the American Society of Anesthesiologists revealed a concerning statistic. Ginger is among the top 5 herbal supplements that can increase the risk of perioperative complications by 32%. But why does this seemingly harmless root pose such a threat? The primary danger lies in ginger's ability to thin the blood. During surgery, surgeons rely on the patient's blood clotting normally in order to minimize blood loss. When blood is thinned due to ginger consumption, it can lead to excessive bleeding that becomes difficult to control. This is clearly illustrated in a study by the American College of Surgeons, published in the Journal of Surgical Research. Patients who had consumed ginger within 72 hours prior to surgery had a 47% higher risk of bleeding and a 23% increase in blood clotting time. Those numbers are hard to ignore. Vitali, 52 years old, shares his experience. I was scheduled for a routine gallbladder removal. A week before the procedure, I caught a cold and started treating it with ginger. During the pre-op questionnaire, no one asked about ginger, only medications, so I didn't think it was relevant. During the operation, there was heavy bleeding that was hard to stop. A surgery that should have lasted 1 hour took 3, and I needed a blood transfusion. Later, the surgeon asked if I had taken any blood-thinning medications. That was when I remembered the ginger. In addition to bleeding issues, ginger can interact with anesthesia and other medications used during surgery. This can lead to unpredictable reactions, including changes in blood pressure, heart rhythm, and blood sugar levels. Imagine this scenario. The anesthesiologist calculates the medication dosage based on your weight and health condition, unaware that the active compounds in ginger are present in your system and may intensify the effects. The result could be overly deep anesthesia or difficulty waking up after surgery. Health experts are unanimous in their recommendation. Ginger should be discontinued at least 1 week before any planned surgical procedure. This applies to all forms of ginger: fresh, dried, capsules, teas, and even foods that contain a significant amount of ginger, such as gingerbread or specialized supplements. Be sure to inform your surgeon and anesthesiologist about your regular ginger consumption, even if you have already stopped taking it within the recommended time frame. This information can influence the choice of anesthesia methods and perioperative care. Remember, your safety during surgery depends directly on how much your medical team knows about what is in your system. Number 10. Ginger allergy, when an exotic spice becomes a dangerous allergen. Exotic spices are becoming increasingly popular around the world, and ginger holds a prominent place among them. However, few people realize that ginger can trigger serious allergic reactions, especially in those with specific predispositions. Ginger belongs to the Zingiberaceae family, which also includes turmeric and cardamom. Cross-reactivity exists among plants in this family. If you are allergic to one of them, there is a high chance you may react to the others as well. According to the American College of Allergy, Asthma, and Immunology, up to 2% of people with food allergies have a hypersensitivity to spices, which can appear with a range of symptoms. Svetlana, 34 years old, shares her experience. I always had a mild allergy to turmeric, sneezing, and light skin redness. I had no idea that ginger is part of the same plant family. One day, I drank ginger tea to treat a cold, and within 15 minutes, I had a severe reaction. My lips swelled, a rash broke out all over my body, and it became hard to breathe. The emergency doctor said it was anaphylaxis and gave me an epinephrine injection. Since then, I carry an EpiPen and carefully read all ingredient labels. A ginger allergy can present itself in many different ways, ranging from mild to potentially dangerous symptoms. For some people, it shows up as a skin reaction, rashes, itching, hives, or redness. For others, it involves swelling of the lips, tongue, or throat, along with respiratory symptoms such as difficulty breathing, wheezing, or coughing. Digestive symptoms like nausea, vomiting, or diarrhea are also common. In the most serious cases, it can lead to anaphylaxis, a condition in which blood pressure suddenly drops, consciousness is lost, and the body goes into shock. What makes this especially concerning is that a ginger allergy can appear suddenly, even if you have tolerated it well in the past. The immune system can become sensitized to an allergen gradually, and each new exposure may cause a more intense reaction. As ginger becomes more popular as an ingredient, it is increasingly found in a wide range of products. People with a confirmed allergy should be extremely cautious. Ginger may appear under different names, such as ginger root, ginger extract, ginger oil, or Zingiber officinale. It can be found in tea, beverages, baked goods, desserts, Asian cuisine, sauces, marinades, dietary supplements, herbal products, and even certain medications. If you suspect an allergy, it is important to consult an allergist. Diagnosis may include skin testing, blood tests for specific antibodies, or following an elimination diet with a subsequent challenge test under medical supervision. In the case of a confirmed allergy, completely removing ginger from your diet remains the only truly safe solution. This requires constant vigilance, careful reading of ingredient labels, and informing others about your allergy, especially when visiting cafes and restaurants. Ginger is rightfully considered one of the most valuable natural remedies, offering a wide range of health benefits recognized by both traditional and modern scientific medicine. According to a comprehensive review published by the National Institute of Integrative Medicine in 2024, regular consumption of ginger in small doses, between 0.5 and 1 gram per day, produces truly impressive results. A reduction in inflammatory markers by 22% was recorded, indicating a pronounced anti-inflammatory effect. 67% of patients with chronic gastrointestinal conditions experienced noticeable improvements in digestion. Additionally, in 78% of cases, ginger effectively reduced nausea of various origins, from motion sickness to side effects caused by medication. Among patients with osteoarthritis, 63% reported a decrease in pain, and the risk of respiratory infections dropped by 35%. However, as we have seen, for certain groups of people, the risks may outweigh the potential benefits. Rather than following a one-size-fits-all recommendation like ginger is good for everyone, modern medicine is moving toward a personalized approach. In its most recent report from January 2025, the American Institute of Nutrition Research emphasized that this individualized use of ginger can reduce the risk of adverse effects by as much as 89%. Mikhail Zelensky, a general practitioner with 20 years of experience, explains, "I do not ban ginger for all my patients with chronic conditions. Instead, we conduct a thorough assessment of the risks and benefits in each specific case. For some patients, ginger can be a great addition to their treatment. For others, it can be a potential threat. Our goal is to find the right balance." If you do not fall into any of the risk groups mentioned above, moderate ginger consumption is likely to be beneficial for you. However, even in this case, it is wise to start with small amounts and carefully monitor how your body responds. Remember, being informed is the key to staying safe. Before adding ginger to your diet on a regular basis, especially if you have chronic health conditions or take medications, speak with a healthcare professional. Together, you can develop the best approach to enjoy the benefits of this remarkable spice without compromising your health. As the ancient saying goes, and it is especially true for ginger, the right dose makes the difference between a remedy and a poison. If you have questions or something to share, feel free to leave a comment. Next, I recommend checking out these videos, and don't forget to leave your likes and comments. I'm looking forward to them.